So now I'm going to be showing you the process on doing it via butterfly needle instead of IV that's already inserted into your patient's arm. Like I said, the process that we begin with is very similar. It's exactly the same, actually. We're going to be asking the patient and clarifying and making sure we're drawing the right patient, have the right orders. We're also going to be gathering all our equipment and donning our PPE, which is our gloves today. The process for cleaning, exactly the same with this type of blood culture. You want to make sure you do the blue first. This is your aerobic. Pop off the top. Thoroughly clean with rubbing alcohol. Clean the sides too. Make sure it's all clean. Pop open a new one. Pop off the cap on the red. Thoroughly clean. Just like you were. Make sure you clean the sides too. This time you're actually going to be inserting a needle into your patient, so you want to make sure you put on the tourniquet first. Once you put on the tourniquet, then you can look for a suitable vein. And once you find that vein, let's just say for me, sake of discussion, here is my hand. This is the vein we want to go for. Thoroughly clean that vein. Okay? And then you can go from in to out to finish in circles. Once the vein is clean and you're ready to insert, our blood cultures we actually have here don't have long necks on the bottles, so we do it a little bit differently than some other places. A lot of places use the same exact transfer device that we would use and just hook it up to the butterfly line itself, but we cannot do that here. So what we do here, what I do anyway, I make sure to, this is also a sharp inside here. There is a needle. You take this off, you unscrew it. This is where your syringe is going to be attached to, that is going to pull the blood out of the line for you to then put onto your transfer device, the same one to put into your blood culture. Make sure everything is sterile. So we're going to take our needle. I try to keep it all in the same package while I do all this stuff, just so it's all sterile. Unsheath the needle and insert into your patient. For the purpose of this video, I'm going to be sheathing the needle again. Once the needle's in your patient and you feel like you have gotten into the venous space, you can then attach to the hub your syringe and pull your blood out. Now, once you have 10 cc's, you can unscrew. Like I said, I like to keep my little package near me and put into the sterile field to make sure it's always sterile. I then take my blood, making sure to clean any of the dry blood off of the hub. Attach it and put into your blood culture. Like I said, you want to do 10 cc's. Attach the second one with a new syringe and insert into your blood culture. With all these videos, we want to make sure we label correctly and have the right lab order so we can send it up and the lab can run it. Put these in individual bags. Also, try not to lump them up with any of the other blood tubes, as sometimes when we're working, dry blood gets on the outside and might run onto the tops of these and contaminate your sample. If you have any questions, please ask me. Thank you very much.